This is the most powerful antioxidant required by every cell in your body to function properly. And if your levels are low, your energy, your detox capacity, your cellular function, and even how fast you age can all be affected. So let me show you exactly how this works and why so many people are using this to help them get well. So stick around to the end, but before we get started, I'm Dr. Nick Zyrowski, and welcome to the channel. If you're new here, it's a pleasure to have you. Be sure to subscribe so that you never miss a natural health video again. Today we're talking about something called glutathione. It's often referred to as the master antioxidant inside the human body. And here's what most people don't realize. Your glutathione levels don't stay the same for life. In fact, they decline with age. And that decline may be more important than you even think. Research suggests that starting around the age of 20, glutathione levels can begin to slowly decline, roughly by around 8 to 12% per decade. Now here's where it gets really interesting. Some studies suggest that even a 30% drop in glutathione may be enough to impair normal cellular function. That means your cells are under more oxidative stress, less efficient at detoxification, and also more vulnerable overall. And this is where many health issues start to begin, not from one single cause, but from cellular stress building up over time. Whenever we work with people in my clinic, I will tell you that glutathione is almost always a part of any protocol that is utilized to get somebody well. So if you're struggling with your health, you're going to want to hear the rest of this. Now, this is why glutathione matters so much. Let's break it down and make it simple. Glutathione plays three massive roles in your body. Detoxification support is the first. Your body is constantly exposed from toxins, from the air we breathe, the water we drink, the foods that we're eating, and even the household cleaning products that you constantly come in contact with. In fact, this shirt I'm wearing is full of dyes and flame retardants and everything else straight from the factory. Glutathione is going to help bind and remove these toxins at a cellular level. Glutathione is going to help the natural detoxification processes inside the body that are inside the liver actually take these toxins, break them down so that you can get rid of them. Now, the second big factor that this glutathione is going to have in your body is the antioxidant defense that it offers. You've probably heard that you should always eat more antioxidants, but glutathione is very different. It's produced in your cells and it helps neutralize oxidative stress right at the source. So whenever we think of having a problem and trying to get to the root cause of it, we always think, how can we get to this at a cellular level? And that's why it's considered one of the most important internal defense systems that we have. We hear all the time, if we want to avoid disease, we need more antioxidants. You certainly need the most powerful antioxidant, and that's glutathione. Now, the third big factor is glutathione will play a big role in cellular energy and function. Healthy cells depend on balance, and when glutathione is optimized, cells function more efficiently, including how they produce energy. And that brings us to something even more interesting, your immune system and your mitochondrial health. Glutathione plays a role in your immune system regulation, not boosting it blindly, right? We want to make sure that we have balance. So it's going to help balance your immune system and keep it balanced. That matters for things like immune resilience. Are you getting sick all the time? Are you not? Inflammatory control and balance in your body, and also recovering from stress. And inside the cell, it supports the mitochondria, the engine that drives everything in your body. When the mitochondria struggles, it affects everything: your energy, your metabolism, your overall long-term resilience. When we think of mitochondrial disorders and how they're related to disease today, we think of the energy system in the body being affected. Here's the thing. Energy isn't just about the energy that you feel every day. Energy is the ability for the body to heal itself, to have the healing potential to overcome challenges. This is something that declines as we age. Glutathione can help support the mitochondria to combat that. The other factor involved here is your immune system. If our immune system becomes very weak or out of balance, this creates the opportunity for diseases such as cancer to take hold in the body. We want our immune system strong, not only to help lower inflammation, but also to help fight disease as well and keep us healthy. So if there's a virus, a bacteria, something out there, we're able to fight it off. Now, here's why so many people are paying so much attention to glutathione these days. And this is where things also get very interesting. Research has observed low levels of glutathione in many chronic health conditions and age-related issues. issues. This includes issues like metabolic dysfunction, insulin resistance, a lot of stress on the liver or even fatty liver patterns, chronic oxidative stress states, neurological aging, and also skin inflammatory conditions. When we look at glutathione and a depletion of it in the body, it's related to many different health conditions that people face today. Up your glutathione, support a healthy cell. So if you support the healthy cell, then you really are protecting your body in ways that you never have before. And this is why glutathione plays a major role in how our body is going to respond to stress and aging. And that's why the interest in it has exploded over time. Whenever we are looking to heal somebody in my clinic, glutathione is always part of the protocol because we know that we have to get the toxins out of the system. The glutathione will help with this. We know that we have to replenish mitochondrial function inside the cell. The glutathione will help with this. It's a big factor. So the question always becomes is how much should I take? So let's talk about supplementation of glutathione and how much you would actually need. One of the biggest issues with this particular antioxidant like glutathione is the absorption issue. For many years, it was kind of deemed useless to take glutathione because you would never absorb it. But here's the thing is now with new science and new research, we can say officially that not all forms are created equal. And that's why the newer form of glutathione like S-acetylglutathione is what is getting attention because they have been able to improve the stability with it and improve the cellular uptake, which is shown to have profound impacts on the body's ability to utilize it and utilize it to improve your health. Now, the big question becomes too is how much of it should we take? We identified that you should use S-acetylglutathione because it's going to be absorbed better. But how much do we need now? Well, according to a lot of the research, a commonly studied range that is going to be effective at a clinical level is going to be around 200 milligrams per day. Now, what I'll do is I'll put a link in the description below to an S-acetylglutathione that is actually dosed correctly at that 200 milligram mark that comes directly from the clinic. And you can be assured that it's pure, high quality, and the same glutathione that's being utilized in the research. I'll put a link in the description below to this S-acetylglutathione. But here's what I personally think about it. I think that as a healthy individual, right, because we have to look at, well, how do we actually implement this into our own life? I think as a healthy individual, you do not need to utilize glutathione year round. Instead, what I prefer to do is cycle it, meaning that maybe every 3 to 4 months, I will go and utilize glutathione for about 30 days. Okay, so I'll cycle on for 30 days, just a couple times a year. So if you were to do 30 days of S-acetylglutathione 3 to 4 times a year, I think that's plenty in order to offer you the benefits and support that glutathione has to offer without overdoing it. Now, for someone who feels unwell, somebody who's struggling with their health, somebody who's trying to overcome a health condition, this is going to be someone who's maybe even dealing with a significant health challenge or a lot of oxidative stress. My approach would be a little bit different. In these particular cases, what I would do is I would utilize glutathione every day over the course of 3 months. And after 30 days, I would reassess the situation. Well, on the glutathione, I would have been monitoring my health the entire time and looking for improvements. And if I'm seeing improvements, I would continue on with the glutathione. If I felt that the glutathione has kind of met its capacity for improving my health at that time, I would discontinue the use of glutathione and then use more of a maintenance phase of glutathione instead. But here's the important takeaway. What you really need to understand is that glutathione isn't magic. However, the research has proven it plays some very, very important roles in our body. It's one of the most important internal systems that your body uses to defend, repair, and also protect itself. I'm Dr. Zyrowski, and if you love this video, check out this one next.